India's healthcare spending is already very, very low compared to most countries. So when the healthcare infrastructure wasn't ready, and this sort of exploded out of proportion, the number of deaths we see, or the beds that we don't have in hospitals, or ventilators are not there, things started to look really, really bad there.
Who do you think are the key stakeholder groups here? And how do you think that feeds into decisions for where to direct resources?
So there's a huge role that central government has to play on social behavior, messaging, communication, labs and research. We are not doing enough sort of sequencing and work in India to even understand what's happening with the strains and what's the behavior and things like that.
Given sort of this supply chain problem right now, what are other ways that donors, especially those not in India right now, what actions can they take to have some sort of a positive impact on the situation?
And I think the right answer is to focus on vaccination 2 months from now. But today's biggest need is, as a society, being able to save the lives that we are losing. You can't solve for all the pain. You can't solve for all the hardships. You can't solve for all the stress, money, all the efforts that are going in. But I think the biggest sort of losses we have is we are losing people every day who otherwise could have been very easily saved. And that is the biggest bottleneck there is healthcare infrastructure capacity, especially oxygen.
The repercussions are going to be with us for quite some time in India and in a number of countries. And I think we need to all continue not just to contribute, but to be in this conversation and to challenge to solve the wider and systemic issue around vaccine equity and access.